we cannot order you to wear a mask. And even if we could, frankly, we got to rely on the goodwill and good nature of human beings to do the right thing. So mask mandate or no mask mandate, please wear a mask, please protect yourself, and please protect others.
We know that our hospital systems are overwhelmed at the moment. And as a community, anything we can do to keep ourselves out of the emergency room is helpful. So not just those mitigation behaviors that I just mentioned, but just in general. Now is not the time to be out there doing, extreme physical challenges or pushing yourself beyond your limits if you have, a pre-existing condition. Instead, now is the time for us as a community to use caution, to use restraint, and to let our hospital staff do the work that needs to be done around COVID-19 without adding additional complications and burden.
And so I think from a community standpoint, it's really asking, and maybe to use your words, Mary, and begging individuals to get vaccinated, to mask, and really to social distance, to go back to those very basics. We need your help. We are not going to be in the position to provide the same level of care if we can't stop the flow of the COVID patients coming into our organization.
Just because the mandates aren't there doesn't mean it's not the right thing to do. And so it's going to take a little while getting the vaccine to have that have an effect. Need to do that. But right now what you can do is you can mask, you can social distance, you can do hand hygiene, you can think about what's right for your family and your friends, because this is not a political issue. Wearing a mask is not a sign of weakness. Wearing a mask is a sign that you care about your friend and your family and your community.
Currently, we have 20 COVID patients in our facility, approximately 1/3 of our overall adult inpatient census. 85% of our hospitalized COVID patients are unvaccinated. 93% of our ICU COVID patients in our facility are unvaccinated. The trends we are seeing are definitely skewing towards younger patients, and our COVID patients are getting much more sick more quickly.
Healthcare resources are not unlimited. And as institutions, we are going above and beyond right now, shifting everything we have to take care of the patients that are in our hospitals and to try to keep people also able to get care on an outpatient basis. But we can't do this alone. We desperately, desperately need the help of the citizens that are our neighbors and our friends and our family in this community. So I ask you, please get vaccinated. Please get vaccinated for COVID. Please get vaccinated for the flu. Please wear your masks to decrease the spread of this virus. And please social distance. It's the basics that we've been doing since the beginning of this pandemic. But the vaccine is highly effective at keeping people out of the hospital. So.
Right now, many of our businesses are still able to operate because we have the great outdoor spaces to use, and it's still warm. But we're just weeks away from a transition in the season. And now is our chance to get ahead of the Delta variant so that as we enter fall and cooler weather, our businesses can stay open and stay in operations, and we can maintain the community character that we all love.
If you have a child that's over the age of 12, I encourage you to get vaccinated, get your child vaccinated. If you have questions about the vaccine, please reach out to your healthcare provider to talk about it. If you don't have a healthcare provider, please contact our school and talk to one of our school nurses about vaccines. We're encouraging vaccines for any child over the age of 12. We think it really helps keep kids in school and keep transmissions down.
The science is unambiguous. Getting vaccinated, wearing masks, socially distancing makes a difference. And this is, and I will follow your lead here to some extent, Mayor Engen, in terms of shading into being a bit preachy here. This is a civic responsibility, I believe, to get vaccinated. This is all about caring for one another and our community. As Dr. McKay earlier mentioned, caring for one another. This is the heart of the matter right now.